Over the last decade, the incidence of cancers like colon cancer is actually falling, and that's due to early detection and early intervention. Unfortunately, cancers like esophageal cancers are increasing due in part to the obesity epidemic.
My brother Jeff Stemberger was engaging, outgoing, and a compassionate man. He had a great devotion to his family, and he also was a man of great faith. Through his efforts and through this diagnosis, he believed that maybe some people could learn and benefit from his experience.
I feel compelled and committed to this cause, not only for my father, but for his legacy. I am here to make sure that his legacy lives on.
The patients who are at highest risk for esophageal adenocarcinoma are obese white men who reflux or have a history of reflux. Chronic reflux leads to a condition called Barrett's esophagus. Barrett's esophagus is the precursor condition to esophageal cancer. When we look with a camera in the esophagus, the normal lining of the esophagus is called squamous, which is like the lining of the skin. The lining in Barrett's resembles the lining in the stomach, and we believe that what happens is the lining of the stomach, called intestinal mucosa, moves up into the esophagus and starts lining and resembles the stomach lining. When the stomach lining migrates into the esophagus, that's called Barrett's esophagus. It's really hard to say how long it takes to develop Barrett's, but typically we think that it takes 5 to 10 years of chronic reflux. If you're also obese with reflux, that seems to accentuate the risk. If you have Barrett's, the Barrett's then can change to what we call low-grade dysplasia, then high-grade dysplasia, then eventually cancer. It's a continuum. So if we can find and detect the Barrett's early, we can intervene and prevent dysplasia from starting. So the good news is that the minority of the people, probably less than 5% of patients with chronic reflux, will develop Barrett's esophagus. We think that there's a genetic component to Barrett's esophagus, and if you have multiple family members with Barrett's esophagus, you should be screened more aggressively and perhaps have interventions done if you have precancerous changes. Unfortunately, Barrett's is something you don't feel, so we don't know whether you have it or not unless we take a look inside of your esophagus with a camera. If you develop dysplasia, there are lots of things we can do now with modern medical advances that can not only reverse the dysplasia, but get your Barrett's away as well. And it's almost like a do-over so that your esophageal lining's back to normal. If you are an obese white man in his 50s, you are at highest risk for developing Barrett's. If you also take medicines to treat reflux, you are at risk for developing Barrett's esophagus. So you should talk to your physician about getting screened. And in some instances, we do an endoscopy to look at your esophagus to see if you truly have Barrett's.
Jeff's legacy is to increase the awareness and the education of Barrett's esophagus.
Trying to prevent any further loss, trying to prevent any further spread of this disease.
It will take efforts on research, medical teams, and patients themselves to make inroads to those goals.